Today we are talking about intrahospital epidemiological investigation. My team is conformed by Camilo Ayala, Diana Sanchez, and Camila Tomas. Well, before we start, it is important to know some definitions like epidemiology, that is the study of the distribution and determinants of health in specific populations, and the application of this study to counter health problems. Another one is nosocomial infection, that is an infection occurring in a patient staying in a hospital, but was not present or incubating at the time of admission, that is from 48 to 72 hours post-admission. Another one is the prevalence, that is the proportion of diseased individuals in a population at a specific time. And there are some more concepts that you need to know to understand better intrahospital investigations that are here in the presentation. Well, another thing that is important to learn are incidences and rates, like accumulated incidence, that is the individual possibility of developing a disease that has a member of population at risk over a period of time. Incidence of rate or density is the rate at which a certain disease appears in a population. An attack rate is the ratio of the number of new infections divided by the total number of exposed susceptibles in a given period of time. And in the right side, you can see the formula for each incidence and rate, respectively.
The outbreak study tells us the definition of nosocomial outbreak, that is increasing the number of observed cases due to this type of infection compared to the expected frequency within a specific time period in a particular hospital. To respond to an outbreak, three things need to be done, like initial evaluation, outbreak investigation, and analytical evaluation. And also we have to consider three things: place, person, and time. And also the video gave us some quality tools like nominal group and cause and effect diagram. Talking about the article, the title is An Outbreak of Hospital-Acquired Pseudomonas aeruginosa Infection Caused by Contaminated Bottled Water in Intensive Care Units. The summary is that the study describes an outbreak of Pseudomonas aeruginosa infections caused by contaminated bottled still water in 6 intensive care units of a German university hospital. And the introduction is that the water is a typical source of outbreaks of infections caused by microbial pathogens in hospitals. To avoid these potential risks, the CDC recommends the use of sterile water for critical activities, and also Pseudomonas aeruginosa is among the most feared pathogens associated with nosocomial infection.
Well, talking about the research objectives, the principal objective was to trace the main cause of the outbreak and know what was the route of dissemination to eliminate it and prevent the spread of causes. Elements. The place were 6 intensive care units at Charité Faculty of Medicine of the University of Berlin, Germany. The principal is a tertiary care referral center with 2,400 beds. Person. Intensive care unit patients infected or colonized nosocomially with any strain of Pseudomonas aeruginosa were included if they had a nosocomial infection or were colonized by the specific strain, along with the review medical records. Time. Microbiological data were reviewed from the 42 weeks before the outbreak, when patient test positive, and 4 weeks post-outbreak. The cases of infection or colonization of Pseudomonas aeruginosa were recorded weekly. Course of action steps. The first is initial evaluation, where samples were collected from ICU surface, cleaning solutions, fluids, and airway equipment. And patients were analyzed based on their microbiological medical stories for suspect-specific or different strains. Outbreak investigation. Thanks to the results of the samples, the investigation focused on the bottled water since the analysis of the results were positive for the specific strain of the outbreak. After that, the information of the batches and suppliers of the water got compared with the periods where infections increased. Analytical evaluation. After identifying the infection source, vulnerable patients were evaluated to determine infection. Diagnoses were categorized into wound infections and pneumonia. Tragically, 3 patients in ICU died, leading to the removal of non-carbonated bottled water and implementation of a protocol using only distilled or purified water to prevent future outbreaks. Thank you.